After our investigative unit told you about prominent black doctors accusing Sutter Health of discrimination, the hospital group, one of the largest in California, vowed to make major changes. But now Sutter's CEO appears to already be hedging on one of his promises of talking publicly about the allegations and what he plans to do about them. It's leaving some to question how serious he is about real reform. Senior investigative reporter Bigad Shaban breaks it all down for us.
Well, Sutter Health CEO Warner Thomas is pledging to end the kind of racism that has allegedly been targeting black doctors at Sutter for years. But despite earlier promises of answering our questions about how exactly he plans to do that, Thomas isn't talking. Warner Thomas has only been at the helm of Sutter Health for 6 months. As the new CEO of California's third largest medical system, he inherited more than 20 hospitals, 3 million patients, and lingering accusations that Sutter discriminated against its own black physicians for decades.
I was exposed to the type of racism that hits you on the back of the head when you don't see it coming.
Over the past 2 months, we've told you about nearly a dozen black doctors who say Sutter Health has treated them poorly, all because of the color of their skin.
There was a toxic environment that just permeated.
I was traumatized.
It's insidious here within Sutter.
Most recently, we profiled a trio of prominent black physicians. Between them, they say systemic discrimination at Sutter left them bullied, harassed, and humiliated, impacting their mental health, pay, and patients.
If underrepresented docs, black doctors, are being structurally eliminated from the workforce, that means that it's going to impact the communities that they serve.
3 days after we aired that story, CEO Warner Thomas sent Sutter's board of directors a letter saying he was personally disturbed by the discrimination claims detailed in our story. He vowed to take several immediate actions. He promised to hire a consultant to work with him on reforms, create a diversity, equity, inclusion, or DEI council for physicians, review internal training and hiring practices, and engage in media requests. Throughout our reporting, Sutter repeatedly declined to be interviewed about the discrimination accusations. But after Thomas pledged to engage in media requests, we reached out again. And his office told us Warner Thomas is willing to be interviewed and promised to schedule it. That was 3 weeks ago. We repeatedly followed up, but still no interview scheduled. Now, the CEO's office tells us, given Sutter's immediate focus on continued advancement of our diversity, equity, inclusion priorities, we are prioritizing implementation over interviews at this time.
It is disheartening to hear that Sutter has walked back that commitment to transparency.
Lisa Holder is a longtime civil rights attorney and president of the Equal Justice Society, an Oakland-based nonprofit focused on advocacy, education, and litigation to end discrimination. She was also appointed by Governor Newsom to serve on California's Reparations Task Force. While she has never filed suit against Sutter Health, her nonprofit has taken on unrelated cases with a law firm that is currently suing Sutter for racial discrimination on behalf of a black doctor.
So for the head of Sutter to say that he can't sit down to answer our questions because he's too focused on addressing this issue, does that make sense to you?
It's a complete oxymoron. It makes absolutely no sense. Part of their strategic plan should be to be very public facing and to be talking to the media about the changes that they're making and their genuine commitment.
When Sutter's CEO wrote his board of directors last month in response to our reporting, he also promised to invite the 3 black physicians we recently interviewed to meet with him personally. We checked with the trio of doctors, and so far 2 of the 3 tell us they've been contacted by Sutter to arrange a meeting. As for when the CEO will take our questions, Sutter still hasn't said, but we'll keep asking. With the investigative unit, I'm Bigad Shaban.